I have a lot of patients coming in and complaining of numbness in the fingers, especially in the morning. Wake up in the morning, their hand is completely numb. There's pain, pressure. What is that? Well, it could be carpal tunnel syndrome. What is carpal tunnel syndrome? Carpal is means the bones of your wrist. Tunnel is a tunnel. So there's literally a tunnel in the wrist composed of your carpal bones, your wrist bones, and the fascia and ligaments above. Makes a tunnel. In this tunnel, there is a nerve and some circulation and an artery that goes through it. Now, some of us are made a lot of us are made differently, and some have big tunnels, some have smaller tunnels. Some of us, the tunnels are affected by swelling, and others less. So if there's less room in the tunnel will constrict and squeeze on the nerve and the circulation. And you squeeze on the nerve, you get the numbness. So why in the morning? A lot of people sleep like this. You sleep like this. Just doing this motion will constrict the tunnel naturally. So if I already have an issue that my tunnel is smaller, or an issue that I have swelling in my wrist, doing this will just increase the constriction on the tunnel and will cause the numbness. Number one solution, wear a resting brace, wrist brace. So the wrist brace will put you in this position here and will open up the tunnel at the maximum possibility. It's going to be the most open you can. So this is called the resting position. So sleep with a brace. That's number one solution. Number two solution, if it continues, then you want to start stretching. Go see a physiotherapist or try these exercises. So you want to, again, open up the hands. So you want to stretch out over here and you want to feel that stretch. You could put your hand against the wall and just stretch it. Just stretch, open up that hand, and it will stretch the carpal tunnel, okay? The tunnel will be stretched open. You could hold that 25 seconds. You could do that 3 times. Problem still persisting. You definitely want to consult a doctor. They'll do a test called an EMG. They're going to pass some current from your arm down past your tunnel, and they're going to measure the speed at which the current in the nerve passes. If it's constricted, then the speed at which the nerve will send the impulses will decrease. So the speed is less, they'll diagnose a carpal tunnel. Hopefully with physiotherapy and more exercises, it goes away. If not, then a 30-minute small surgical intervention is required, where they just cut open one side of the tunnel, which is composed of the ligaments. They cut it open, it opens up the tunnel, frees up the compression, no more symptoms.